Thank you. Next presenter, please, Dr. Indrayudh.
Good morning, respected judges, seniors, and my colleagues. Today, I, Indrayudh BANDYOPADHYAY, stand before you to present Vartalap, a novel counseling-based approach for quality eye care, and my co-author is Dr. Tanveer Ahmed, sir. The role of today's modern ophthalmologist is to guide the patient holistically towards a good health, both physical and mental. However, in today's fast-paced life, this is a Herculean task, as both the patients and the doctors are overwhelmed by the huge crowd in the hospital, and comes a time constraint, and as a result, what happens is the symptoms are treated, but not the patient. Therefore, it is an initiative to provide a counseling-based, tailored, non-pharmacological approach to the lifestyle modification to promote the health of the patients, utilizing the time in which they wait for their turn in refraction room. My aim was to promote the quality of life by changing the knowledge, attitude, and practices of the patient with the objectives of ascertaining socio-demographic data, to understand the prevalent practices adopted, and to provide counseling regarding betterment of quality eye care via day-to-day activities. Now, my study population was all patients and attendants above 12 years of age attending ophthalmology OPD outside the refraction room. The study duration was of 6 months, and it was a prospective, observational, descriptive, questionnaire-based longitudinal study. All the patients and attendants attending ophthalmology outpatient department in the waiting area were included, and very sick or non-consenting subjects were excluded. It was done by a purposive sampling, and 719 subjects were included. There was no financial sponsorship or conflict in interest. Informed consent was taken from all adults, and assent was obtained from minors with consent from the parents. This is a questionnaire that we have used, which was a modification of the SF36 questionnaire, and personalized counseling was given in a Socratic manner. And coming to the results, we found the 719 patients, of which 660 opted for the counseling and rest 59 were treated as control group. Of this, 36.44% were females, and maximum age group was from above 60 years. These were the symptoms and divided as per the groups of those who opted for the counseling and those who did not. And as we can see, it has been tabulated, and scorings were done in the Likert scale. 40% reduction of foreign body sensation was observed in the group seeking the Vartalap program compared to the 22.8% in the control group. The incidences of headache, fatigue, and watering were reduced significantly in this group, which is 34.8% with respect to 28.7, 25% with respect to 18.75, and 43.9% instead of 39. As assessed, we found that quality of life improved by 21.7% in the group which opted in for the study, in contrast to the 13.3% in the control group. The dietary suggestions had the maximum adherence, which is 82.1%, followed by adherence to exercise, then screen time reduction, which came to 41.3%, and the least followed advice was regarding cessation of addiction, which was only 12.7%. Coming to the discussion section, similar studies were found in Department of Psychiatry, where with pharmacological therapy, non-pharmacological approaches were used, like in the studies of Corbisiero et al. And Kamenov et al. No similar studies were found in ophthalmological standpoint. These are my references. Thank you.
So, what was the content of this Vartalap? You said a novel counseling-based approach for quality eye care services.
So, in this study, actually, what happens is if a patient requires refraction, mostly topical lubricant is given along with the prescription of spectacles. But with this, they often have residual complaints which they don't actually get addressed, and patients also have a huge time crunch, and neither the patients nor the doctor actually can handle this situation in the huge rush. So we have taken up the area waiting time in the refraction room, because like for refraction we usually have around 100 patients per day, and patients utilize this time for addressing their queries, like what else can they do other than the treatment approach.
No, my question is, you have the counseling, because we, in the practice, we usually do a counseling for cataract surgery, but yours is something like a novel, Vartalap. So I want to know, like, consider that the counseling we are doing routinely, there is the traditional kind of counseling methods. That you are saying this is a Vartalap, is a novel counseling-based approach. So what
Sir,
is the novel, what is the new thing here? I want
What
to
is the
know.
content of this Vartalap?
इसमें क्या
So
था?
in this content, actually we ask for any additional problems that they're having in their day-to-day life, firstly. Then they might, like the most common thing that we have heard were headache and fatigue, which is often also not even addressed all the time by just refraction alone. Because headache also has multiple factors, like the day-to-day activities. Like, for example, a person who works in front of the computer 8 hours a day without any kind of break, until and unless we reduce their screen time as such, refraction only has a limited role. But this is the thing which they many times hide just for getting the spectacles, and then they go away. Instead of this, we give them the spectacles as well as their medications. But as we probe much deeper, these issues come up where we give the counseling that they are to reduce their screen time, improve the quality of their diet, which is usually not addressed in a government hospital, like the aspect of diet as well as exercise, like the orthoptic exercise, which I mean.
So one more thing, is there any, like, suppose a patient comes to you, and is there any, like, okay, there's a specially a dedicated counseling center, and there has to be someone who can decide about the behavior of that particular patient, someone is accompanying, something like, it's a new kind of thing, like, because in the practice, in OPD, we usually counsel, so is it something like that? Like, because one
Pardon,
accompanying
sir?
person who can decide, okay, something like that.
So, could you please repeat the question?
The question is that was there any counseling center? Who was
No,
giving
sir.
who was giving the counseling?
No, sir. It was us only.
Doctors.
It was us, the PGTs.
Special counselor or
Yeah.
counseling center or doctors themselves do
So the doctors themselves.
residents do it.
The program we named it as Vartalap, and
So if you do counseling, then how will you manage your OPD?
sir, actually we did it by taking the day off. One of the PGTs are always on day off. Like the one who did the night before, we get the next morning off. So we actually utilized that morning session and came to the OPD just for this purpose.
Okay, thank you.
Okay, thank you.